Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports injuries and exercise injuries and injury treatments, injury prevention, health and wellness for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. And one of the most common questions I get from patients after surgery, whether or not they're athletes or just active people, weekend warriors and that kind of thing, but one of the most common questions I get after surgery that they wish they had asked before surgery was, can I drive after surgery? And they wish they ask it, a few days after, but they really should have asked it before. And in this Ask Dr. Geyer video, I want to answer that very question because I think it's really an important one to ask. Alan asks, I had a large tear in my dominant left arm's rotator cuff that was repaired. The 2 weekends and 1 week of getting rides were a mixed blessing. I found myself riding with the driver, arguing on the phone for most of the distance. I'd rather take my chances driving myself. My surgeon cited driver codes which I've not been able to find. My wife barely speaks to me for taking the sling off for brief periods. I almost talked my mom into assisting me in trading my 5-year-old car in, as it's the stick shift of my current car which seems less than safe. Okay, that's a great question that Alan asks, and it really gets to something that's very important. Now, every surgery has different restrictions, so I'm going to really discuss shoulder surgery, and I will say up front, like I always say in these Ask Dr. Geyer videos, this is not meant for specific medical advice, so please talk to your doctor about specific advice on whether or not you should drive after surgery. And obviously the restrictions after knee surgery and ankle surgery might be different than after shoulder surgery. The challenge with a shoulder surgery, be it labral repair, rotator cuff repair, biceps tendon repair, that type of thing, is that very often you're immobilized in a sling or shoulder immobilizer where the surgeon makes you keep your arm by your side, and it may be for a few days, but it may be for 2 weeks or 4 weeks. And I know a lot of us drive one-handed. I do it all the time, just out of habit, but I have a healthy, other arm. If I have my left arm on the steering wheel, my right arm is down, I can get it up suddenly and grab the steering wheel with both hands. And you need to be able to do that. You have to be able to swerve the car suddenly to avoid some kind of problem. And if your arm is in a sling, even if you take it out of the sling, right after shoulder surgery, you're not going to have the motion, the free range of motion, or the strength to lift it up suddenly. So I'm sure that you probably can drive after surgery, but that doesn't necessarily mean that you should drive after surgery. Generally, after shoulder surgery, it's usually at least 2 to 4 weeks, depending on the type of surgery you have, and then how quickly you get your motion and your strength back. So even after you've been taken out of the sling or the immobilizer by your surgeon, it may be a little longer than that before the doctor basically says it's okay. So again, I would ask your doctor specifically. The other thing is, and I have heard this, I've never actually researched this, and I'm not 100% sure where I would ask, but I've heard this multiple times, that if you're driving along and you've got your shoulder in a sling and let's just say somebody rear ends your car, it's not your fault at all, but you get out of the car and you're in a shoulder sling, if that driver has a good lawyer, you're going to lose. That, even though it wasn't technically your fault, the accident was, what his lawyer or her lawyer might effectively say is that you shouldn't have been driving because you just had shoulder surgery and you can't use your arm. I don't know if that's true, but I've heard that a number of times, both with orthopedic surgeons, and I've heard an attorney tell me that. Maybe you know attorneys that disagree with that, so please let me know that, but I'd be very, very hesitant. This, again, is not so much a matter of whether you could drive, it's much more about whether you should drive. So always ask your surgeon, and preferably ask before surgery so you can make arrangements. Now, was this helpful for you? I'd love to hear your comments. If you've had shoulder surgery, what you potentially did to drive after surgery. Did you get help, or did you try to make do, and how did it go? And if you know somebody that this video would be helpful, please share this video with him or her so that maybe he or she can get benefit before they undergo shoulder surgery. Now, if you like this video and like more like this on injuries, injury treatments, or prevention, and you have questions like this, definitely subscribe to my video site. You'll get videos like this a couple of times a week. Also, if you have a question you'd like me to answer in one of these videos, please send those my way. Now, I would love to share resources on ways to stay healthy and perform your best. And I can do that completely free, and I do it in a way that I don't typically share anywhere else on my website or podcast or really in these videos. So go to my website, drdavidgeyer.com, sign up for my email list, and you'll get those resources delivered straight to you. I hope you liked this video, and I hope it was helpful. Again, if you have other questions you'd like me to answer, please send those my way, and I look forward to seeing you right here next time.